Causes and treatment options for shoulder impingement syndrome. Well, as we've already addressed, shoulder impingement syndrome is quite a painful condition involving the shoulder joint. So what causes it? Well, there are four main causes of shoulder impingement syndrome. Number one would be poor posture. When we have that sort of quite typical rounded shoulder posture, our shoulder rolls forward, it compresses that supraspinatus tendon and increases inflammation or compression in that shoulder joint. So that's a big cause. Number two would be bone spurs. So acromion bone spurs or bone spurs of your supraspinatus tendon. So that's number two. Number three would be shoulder joint instability. So if you have quite an unstable shoulder joint or you have asymmetrical strength between your rotator cuff muscles, it can affect the stability of that shoulder joint and then therefore can create discomfort or pain in certain positions. So number three is shoulder instability. And number four would be the main one, which is repetitive overhead type actions. So people who do a lot of shoulder pressing at the gym, people who do lots of painting, so painters painting a ceiling, or even something like hanging the washing out. My own grandmother noticed shoulder impingement syndrome she had a microwave that was way too high for her, and trying to put plates and things in the microwave, she kept lifting her arms up. So one of the things we had to do was drop that microwave down to a lower level for her so she wasn't having to put her hands up. So they're the main four. So just to recap those causes: instability of the shoulder, bone spurs, poor posture, and repetitive type actions above head. How are we going to treat it? Well, the first thing is got to rest for a couple of weeks. So whatever it is that's causing you pain, stop doing it. Number two, using ice to reduce inflammation of that supraspinatus tendon, and that bursa is really important. So applying ice multiple times a day for a few weeks is number two. And the last one would be consulting with a musculoskeletal therapist. So that might be having some dry needling to the shoulder. It might be to have some therapeutic ultrasound, or it might be to have just some massage through that tendon or the surrounding rotator cuff muscles. And then once your pain's better, we can progress you to strengthening up those surrounding rotator cuff muscles if it's an instability type problem. Then go back and do all of your activities that you want to be doing.